especially considering this report. This is our COVID-19 report, right, on what the county is doing. And do we have any good news?
We sure do. Imperial County has great news. Let's talk a little bit about our county data and our data monitoring list. A little bit of background with that. For the last few weeks, many of our groups, our hospitals, our community groups, the public health department, the county, had been working with the community, the face covering, sending that message, the social distancing, the limiting the gatherings and staying home if you're sick and all those other messages. And so 3-4 weeks ago, and I'm just going to talk about 2 points. 3-4 weeks ago, we were the county with the most cases per 100,000 population in the last 14 days. Actually, we were 2 to 3 times higher than the county of LA, and that's a population of 10 million. But today, let me tell you that we stand at 209. And those are this morning's numbers, and that's over a 14-day period. So jumping down from 800 to 200, that's awesome. That's great progress. And then the other area is the testing positivity percentage, and that's a 7-day average. 3-4 weeks ago, if you may recall, we were in the high 20s, low 30s. Today, this morning, I checked, the numbers were at 13.8%. So the community should feel proud of itself. I feel proud of the community. We've made great progress, but we're not done yet. So keep practicing those good hygiene habits and the social distancing.
Not done yet, but it's certainly good to hear good news every once in a while.
That's right.
It shows we're making progress. So all the naysayers can start putting their masks back on. It works.
We would definitely ask for that support.
We would definitely need that support if we want to get out of this thing. We got to have everybody involved in this. Don't you think?
Yeah, Tracy made it very clear when she answered the phone this morning to make some changes, and we told her we're working on it.
To make some changes?
Yeah, she said, speed this up. Very clear when she answered the phone this morning.
I think that's Janet's problem. No. No, that is terrific news, Janet, and I'm really glad to hear that. For anybody who doesn't know Janette Angulo, you're with the Public Health Department.
That is correct.
So you know exactly what you're talking about.
I'm sorry?
So you know exactly what you're talking about.
Well, this is what we sleep, eat, and breathe every day now.
Yeah, I think everybody does, kind of. It involves every single person in the United States.
Yes, but I'll just take a quick moment and say we're working towards the right direction. We just have a little bit more to do. And when we reach that point where we are stable, and this is important for the community to know, we must show a 14-day stability. And these parameters are set forth by the state. And once we reach those 14 days, the public health department, the health officer, will have a conversation with the state, and we will have a report ready letting them know that we've met all those parameters. And then we'll discuss about, the next stage and reopening of the different sectors. So hopefully that conversation happens very soon.
That is very important to the small businesses and the community at large. We got to stabilize.
Correct. We got to stabilize. We got to sustain that stabilization.
Yes, we can, and I think we can do it. If we got the numbers down to where they're at right now, we can do better. We can do better.
Yes, and it takes all of us. It's personal responsibility, and we've gotten very far, and I'm sure we'll reach our goal, like I said, very soon.
Yeah, and what people have got to stop doing is realize that it is their responsibility. Quit blaming the people that keep the numbers and do their part. We all got to do it.
Yes, from the person that stays at home to the individual that goes out in public because of, whatever business they have to do, to the employee, the employer, everyone. Everyone has a role, a very important role.
Well, in the near future, we've got an extra incentive, excessive heat warning. Nobody wants to go out in that. That's a good reason to stay home and sit under the air conditioner.
Yeah, but that also brings up a good point. It's that also a time when many of us Valleyites travel outside of Imperial County to escape the heat. But we ask that if you have to do that, that you still maintain do that in a responsible manner. I think everybody from the Valley likes to either go to the mountains or travel to the beach and enjoy in the cooler weather. And of course, there's no law stopping you from crossing the county line. However, we do ask that you do so responsibly. Just because you go to another county and they don't have the same restrictions, you still need to watch out not just for yourself, but your loved ones and your coworkers when you come back to work the following day.
Yeah, you go to San Diego and drop your responsibilities. All you're doing is bringing back their COVID-19.
Yeah, and it's normal, like I said, just because we do have high heat, like we're going to be experiencing this week and next week, but we still need to have that responsibility. I need to say, I think our community is doing a great job. It's obvious in our numbers moving in the correct direction. So I want to applaud the people that are helping us. I've said it before, I say it again, help us help you.
Yeah.
We can show the direction, but the community actually leads the direction. Even though we might be helping lead the pack and, working with the leaders of the community is that's going to set the direction of where we need to go. And I think they're making a statement by showing a positive direction of where we're going. And so I applaud them for that and thank them for their assistance.
I do too. I think we did a good job, all of us, because we're all in this together.
Absolutely.
And I don't know. Did you want to talk about the trailers, the assistance for the Nyland people?
Absolutely.
We got a notification that you got some trailers in now.
Yeah. So I think we're moving 19 families this morning. At least 15 are being moved this morning. Traveler trailers have been set up, established. We've had a great working relationship. I was talking with our business recovery task force group that we had established through this COVID thing, and started talking about something and didn't realize it. But, a lot of our businesses have taken a hit, of course, because of the COVID issue. And this was one issue where we were able to utilize some local business resources to bolster some of the activity that took place. I mean, if these trailers had to be moved, some minor things needed to be purchased, and we did it all locally to try to help the local community as well. So we got those moved. We've taken up trailer spots at a trailer park in Calapat, Brawley, and Island. Those are spaces that would have been left empty. So it's kind of a little boost for everybody involved and a little bit of sharing the wealth based on the disaster, but we were able to make some positive out of that. We are moving the displaced families. We have a great deal of work being done up in Island that's been done, the asbestos checks, the removal of any household hazardous materials, and the remaining cleaning of the properties is taking place over the next couple weeks. Arrangements have been made, and it just shows you how strong our community really can be and come together and offer services. We also had some groups that have set up donations, and I was very impressed with what I saw these groups put together as far as bedding, household materials, silverware, dining ware, cups, just putting together packets for the people that lost everything as they're moving into these trailers. So it's not like they're just moving into an empty travel trailer, but they have the accessories needed to have some normalcy in life.
Yeah, so it a little bit different, mix things up a little bit. The disabled, the people in wheelchairs, they're going to have to stay in the hotels, though, right?
Yeah, so there's a couple things we're working on based on the disabilities, and there is a few that need to be addressed. Whether we can make accommodations for them to be able to utilize the travel trailers based on their disability, and if not, we will continue to house them in the hotel until we can come up with our other accommodations.
And the reason for that is that the doors are not that wide in the travel trailers. They just don't make them like that.
Absolutely. So, yeah, travel trailers just aren't set up like that. But based on what they are in a wheelchair, of course, we'll make those recommendations and get that fixed for them. But we have the accommodations already, and we're working with everybody. So it's just heading in a positive direction. We appreciate all the community's help for that.
So you got 19. You're expecting more, right?
No. We have 19 set up.
Okay.
Actually, so there's two initiatives going on. We actually have a total of 71 travel trailers. 34 are being utilized for anybody that was displaced in the Nyland region due to the fire. The remaining are part of an initiative for housing homeless throughout the communities.
There you go.
We're working with the cities. We're working with some groups along with the cities and partnerships, potential nonprofits, to house those. That initiative, those trailers start getting moved. I can't remember if it was today or early next week, being moved and put into place throughout different areas to accommodate housing. And those 71 are on top of 10 that we set up initially at the beginning of the COVID incident to house COVID-positive homeless people to have a place to live and recuperate after leaving the hospital.
Okay, and there is. I read that there, somewhere that there was more state money for the homeless, badly needed. Are we getting any of that?
Yes, there's a lot going on. You have Project Room Key, you have Project Home Key. There's a lot of resources being made available, and it's everything positive.
Yeah, and they just made available. What was it? $600 million for small business loans. El Centro got a chunk of that.
That's correct.
So we're working in the right direction. We can't take care of everybody all at once, but everybody's getting covered.
That's correct.
So that's good. Anything else you guys want to add? You're going to take Janette to breakfast, aren't you, when you get done?
No, I just want to send that reminder that, we still have COVID-19 in our community. We're working really, really hard to recover. I think we're all tired of staying at home, or we're all tired of not doing the things we like. But again, we need to show stability. We need to move forward. Our businesses want to reopen. Some of our schools and our parents, they want to go back to school. Some not. Just the different types of activities that we want to retake again. But we have to do it in such a manner that's safe and that it's healthy for the entire community. So keep practicing those good habits, washing your hands often with soap and water, covering your face with, cloth face covering, staying home if you're sick. And again, just those general prevention messages such as social distancing and the rest that we've been telling you over and over again. You guys are becoming pros at it.
Okay, if we can get these numbers down to where the goal is there a possibility that schools could open up in the fall? And I say that personally.
Well, that's a conversation that we continue to have with the Imperial County Office of Education and the schools. We will take a look at how stable our data is and how ready we are to move forward. And again, those conversations happen with the superintendents and with the public health department, and then we'll decide what the next step will be. So at this point, it's been distance learning, and then we'll take it a step at a time when the time comes.
My problem is I have a grandson at home. He'll be a senior this year, and he wants to play varsity football. And he won't leave me alone. He wants to know when the schools are open and if he's going to be able to play varsity ball. He's 16 years old. What can I say?
Yes, sports are, a huge part of, a high schooler. But yes, going back to school, sports, and much more is being discussed right now.
Okay. So we're looking forward to it, but we haven't made a decision yet.
Distance learning, that was the message sent earlier by, schools and superintendents and ICOE. But again, as our situation changes, it's fluid. And as things get better, then we'll reassess and we'll keep the community informed of the steps that will be taken.
Okay, we're not there yet, but by what you mentioned earlier, we're looking good.
We're going the right direction, yes.
There we go. All right, I thank you guys for checking in with us and keeping us up to date. You don't know how important this is for everybody.
No, and that's why I really appreciate this partnership we've always had with KXO. You guys have always been great to work with and make it happen. So thank you guys.
Well, I still call you Chief because we've been going back years and years and years when you were Chief.
Well, we've been friends for quite some time.
Long time. I used to work with your dad.
Yeah.
So, way back when. All right, sir. Thank you very much. Annette, it's always a pleasure to talk. I think this is the first time I ever talked to you, but it was an absolute pleasure.
Likewise. It was a great pleasure.
All right. Well, I guess you guys will be with Carol Buckley next Friday.
Sounds good.
And hopefully we can keep the positive note moving.
That's the goal.
Thank you, sir.
Thank you.
Bye.
Take care.
Bye-bye. Janette Angulo with the County Public Health Department and CEO, County Executive Officer, Tony Rouhotas, Jr.
I remember